Hello, today's demonstration is about anti-embolism stockings. So I'm going to talk about it just a minute or so before we actually apply the stocking. When we say anti-embolism, we're talking about those tight stockings that are worn anytime somebody may have had surgery and they're not as mobile as they normally are, or if they're just not mobile at all. We tend to get sedentary sometimes. Inactivity can cause the blood to pool in our lower legs, which causes the possibility of deep vein thrombosis. So when we're talking about a thrombosis, we're talking about a clot that is stuck to the actual vein. So we want to help that blood supply get back up to the heart. So sometimes when our veins get just a little bit saggy, we have to add a little compression to that lower leg. So this is not a one-size-fits-all. These are measured for the actual patient. So this is something that you're gonna go to the supply closet and you may see a packet that has different sizes, and inside that packet it's going to have a chart that's going to help you measure. Many times the nurse has to measure this, or the doctor may measure this, and there are two kinds of stockings. There are knee-high and there are thigh-high. So you see here the shorter stocking, the knee-high, the longer all the way up to the thigh in the groin area. And I believe you have this particular style in your gift packet. For in all intents and purposes today with the demo, I'm just going to show the knee-high. So this is measured. It comes with a little paper tape measure, and it even has all the instructions on here. It says for the thigh-high length, we're going to measure the thigh circumference, the calf circumference, and the length from the heel to the buttock fold. And then it has different colors here for whether it's going to be a small, medium, large, extra large sizing. And then other information on the other side regarding the knee length or the knee high. And we would be measuring from the calf circumference and even the length from the heel to the back of the knee. So that being done, and you've decided on the little chart what size this patient should have, then we can choose from different colors. I do have a flesh tone. I have the normal white, which we see for the most part, and then there's even I think a black or even a navy. So it doesn't have to really look odd if you're wearing them out in public. The next thing is I'm just going to talk about the application. So the one I'm going to use right here, the landmark for this is the heel, because sometimes they will have an opening at the toe. It might be on top of the toe, it might be underneath the toes, or there may not be an opening at all, as you see here. So this one has one on the top, but what I'm looking for is that heel. That lets me know where I can get this anchored correctly. So I would knock on the door, check on my patient. I would ask her if she could state her name for me. And this is Miss Wall. So I'm Luann, I'm your nursing assistant today. And I've gotten instructions to put your stockings on your legs. Is that okay with you? And she says, yeah. So I know I've got the right patient. And I'm gonna pull that privacy curtain, and I'm only gonna expose one leg at a time. Now I'm only going to put one stocking on today. I would obviously put two stockings on most of the time. I would put this on while she's in bed, before she gets up and her legs start to swell. I may even want to elevate her legs just a little bit because they are, it's just easier for the patient. So it's clean and dry. I want to make sure that her skin condition is good before I ever put this on. And I think I'm ready to go. So I'm looking at that heel. I'm facing the heel away from me because I like to apply it from the bottom of the foot like this. And I'm scrunching down to about the heel area, and I'm going to let all that extra material just kind of flop down. And I'm trying to go over the toe and the heel as far as I can, and then I will bring the rest of the stocking up to just about the ankle area. Now I'm going to stop and adjust. I'm looking, do I have that heel equally distributed around the heel? So I'm looking how much is on the back, how much is on the underside, and on the side. So that looks pretty even to me. Not too much pressure on the toe area. This hole allows me to look at the toes, look at the circulation, and then I can proceed up the leg. And I am looking that this is the proper size, that it is fitting correctly, that it is even, that there are no twists or wrinkles, because the compression with this, as it helps the blood supply to go back up the leg, if I have a twist, I can almost create a tourniquet. I could decrease the blood flow and cause more damage to her leg. All right, so that looks good to me. I would cover her back up. I would proceed on to the other leg. All right, making sure she's okay, and she's always got to have that call light. She's going to call me if she needs me. She's safe. And I have applied her stockings, and now I have to go document that. So I would document that on the record that she had a knee-high stocking applied. Now she can get up out of bed, and as her legs dangle, she's not going to have all that increased swelling, and it's going to help get that blood flow back up to the heart. So we're trying to keep those clots from forming, because if clots do form and they break away, it's called an embolus, and that can go to the lungs or to the heart and cause some fatal damage at that point. Hope that's been interesting for you, and thanks so much.